Audiology, it's a profession of evaluating and treating hearing loss, balance disorders, tinnitus and ringing of the ear. We work with anywhere from the newborns all the way to the geriatric age. A lot of our practice is really based on hearing aid dispensing and really improving people's quality of life through better hearing through hearing aids. Our first responsibility for our patients is a medical exam, and so when people come to see us, usually something has happened to trigger why they've come in. It could be a sudden hearing loss. People are just beginning to notice that they have difficulty hearing, understanding speech. Oftentimes, unfortunately, it takes somebody 7 years to come and see us. 7 years prior, they have found out they feel that they have a hearing issue, but it takes them 7 years to finally come into our doors. So we're trying to improve that if we can. But when somebody does walk into our office, we do a thorough case history. It's a medical case history. We look into their ear canals to make sure it's not an earwax issue, make sure the eardrums are functioning and there's no holes in them and such. And then we bring them into our soundproof booth and we have a thorough exam where we actually are looking at giving them beeps in their ears and allowing them, or helping us see where they hear and how they hear in certain pitch levels. The majority of hearing loss is due to age-related. As we age, our little tiny hair cells that we have inside of our ear, our hearing nerve, they deplete about 0.5% per year of our life. So by the time we hit a certain age, especially over 60, you're going to begin to have some type of a hearing loss. When people get their hearing aids, you cannot just let people go out into the world with hearing aids by themselves, just with the volume. The brain has to do a lot of changing. And so we spend a lot of time counseling our patients regarding what expectations they have when you have that first volume coming back. You have to remember, these patients may have not heard for 20 years. And so that system is not used to all this sound coming in. And so we have to counsel a patient, explain that your neural pathway, the hearing pathway in your brain, has to form again. So the more severe, the different type of product we have to do. You may see people that have like an ear mole, like a piece of plastic in their ear, then the tubing comes up and then the hearing aid sits behind their ear. That is more for power, for people who need power, who have a more severe hearing loss. If somebody has more of a mild hearing loss or moderate hearing loss, then we can do the really thin tube ones, the really thin tube that come up and sit behind the ear that way. Those are then more effective. If they have normal hearing in the low pitches, they can still hear that hearing without plugging their ears up, but we're giving them back the high pitches they need from that device. If it is a hearing aid or other kind of assisted listening device, then we will walk hand in hand with them as well in that process to make sure that that's a positive experience.